COVID is tearing at the collective consciousness. What do I mean when I say that? We are social animals as people. We're just smart apes. You know how apes are always picking the little bugs off each other and grooming each other? People as a species, we must interact, and we live in groups. We don't live isolated. If you want to punish someone, isolate them. Solitary confinement. Lock them up. That's how you punish people. We are social animals. And anything that interferes with us forming groups, interacting with one another, interfering with our interaction is a problem. Masks. I'm not saying to use them or not use them. I'm just saying their impact on our collective consciousness and our social interactions. So if you cover this part of someone's face, right? Let's get a piece of paper. And if you cover this, right? And you just see my eyes, you cannot know if I'm speaking. You cannot know if I'm smiling, see? Or frowning. So verbal communication and nonverbal communication. The nonverbal communication is 80% of how we interact with each other. So it's completely compromised when we put masks on. For example, I'm walking in Publix, our local grocery store. I bump into a man's cart. And I think, oh my God, he's staring at me. And I thought, well, I've seen people yell and scream at each other in Publix because they bump into each other's carts and they get within 6 feet. And he says, I'm smiling. I walk into Starbucks and the woman's talking to me for like, I don't know, it was probably only like 5 seconds, but I didn't know she was speaking because I couldn't see her lips. So without that feedback, to know that someone's speaking with you, the whole interaction is more aloof. And those staring eyes can be very threatening. Without the lips to tell me it's safe, it's good, it's bad. And people have hearing problems. They can't, you don't realize a lot of people, their hearing is compromised, but they're not really deaf. But they compensate by watching people's mouth. If you can't see their mouth, it's really hard to know what someone is saying if they're talking to you. And this just keeps people apart from one another. It stops social cohesion. It stops their interaction. The nonverbal communication of your mouth is critical. And if I have someone in my office, I have to see their mouths. They got to take their mask off. Here's another one. If a nurse, I'm talking to a nurse and she says, well, we have to have the patients see our face because if they don't see us smile, especially the children, they get very upset. They get agitated. So if you go to touch their wound or an area or put a needle in them, they can't see you smiling and know you're safe. The kids freak out. You have to see people's the lower part of their face, their mouth, their facial expressions. A lot of muscles are here. A lot of communication takes place here. Another way this COVID's affecting us, I talked about the whole mask, nonverbal communication, but just because you have to support people and be around them. And you need to be immediately around them. Phone conversation, FaceTime doesn't work. So I have one kid, he's at University of Florida and he's in a studio. All the classes are virtual at University of Florida. So he's alone, he's doing his classwork. He's got too much alone time. He's calling his friends, but in the dorm, no one's allowed in the dorm unless they already are a part of that dorm. So his friends can't support him. And random people in his dorm building don't count. He's a senior. He's made friends. He tried to kill himself because he just couldn't have that support of those friends. This is not how people work. And another girl called me from a boarding school. She was in a psychiatric hospital. And I said, what happened? And she said, you know, it was a high school, but it's a boarding school. She said, lock us down at 6 o'clock after dinner. And, you know, you're in your room and that's it. And she said, it's just unnerving and dissociating. And, you know, she tried to kill herself. These calls keep coming. I've got another one. She's involved in a major city and she's in the theater program, and everything is virtual. There's no support, there's no interaction with peers. It's not working. It's another one tried to kill herself. Not only that, so we talked about the limitation of communication, which is limiting our interactions and our social bonding. Just like the apes were grooming each other, we can't speak to each other, we can't be next to each other. We're not socially bonding, the intimacy is not there, the cohesion, the social connection. But also, the third point is fear of contamination, fear of infection, right? So we're paranoid of everyone. That's not good. So there's a built-in fear of interacting with other people. That interferes with social cohesion, bonding, intimacy. Another big one, there are no group meetings, no funerals, no weddings, no parties, concerts, sports events, what else? Family gatherings. People are afraid of engaging, and that's breaking our cohesion right there. It's really putting the zap on it, and that really, people feel disconnected. They feel isolated when they do that. You have problems. I'm going to go on with other reasons we're not socially connecting, but what I'm seeing in my patients, depression, anxiety, domestic violence, self-medication with alcohol and drugs, problems with food, apathy with exercise, withdrawal. Another key component is when people travel, they interact, we mix cultures, we build bridges. It's not happening. There's no traveling going on. If it is, it's minimal. The work environment, this is what I'm observing with my patients. This isn't research on the internet. This is just what I have come up with. So at least it's original. I figured I'll add something to the universe and not just repeat what people say on the internet. This is all in individual work that I've done. The employment situation has changed where working in groups is pretty much stopped. It's very hard to work in groups. It's being disrupted. And then another aspect is the disruption of the family unit, the work unit, the entertainment industry. All these together are just falling aside. And this brings me to another topic. With all these things breaking down, I'm finding 4 types of people emerge. Group 1. Group 1 are people who are elderly or predisposed or have some medical illness, heart, lung, immune disorder, that makes them high risk to getting COVID and becoming very sick or dying from COVID. That's group 1. So these people are completely isolating. They think, okay, I'm too old. If I get it, I have a lung problem. I have bronchiectasis. I have severe asthma. I have pulmonary restrictive lung disease. I have emphysema. I have some congestive heart failure, hypertension, obesity. I smoke 2 packs of cigarettes a day. I get it. I'm doomed. That's one group. They're isolating, and they're smart to do so. Second group, they have no predisposition to get COVID or make it worse for them. They have no medical problems, but they have developed a psyche, an outlook towards the world that, okay, I've taken this, they've taken it way too far, and they're extremists, and they're almost like bunkering mentality. They've completely cut off from the world because for whatever reason they're taking a dramatic stance, which is, I think, ridiculous. It's mentally ill. They've isolated themselves totally for no apparent reason, except that they're afraid of COVID to the point where they could not interact with anyone. That's about less than 10%. I would say 20% is the people who are elderly or have some sickness or isolating. Then I would say about 20 to 30% of the population is this. I'm over COVID. It doesn't exist to me. They're in denial. They say, I'm young, I don't care, it's no big deal. They said it's ridiculous, it's a conspiracy, they don't believe it. Total denial of COVID. That's another group. Could be as high as 30%. Completely, they do whatever they want, whenever they want. I think they're dangerous people. I don't agree with that. I'm a member of the next group, which is probably 40 to 60% of the population. Their attitude is, I'm going to minimize my risk. I'm going to be careful of large gatherings. I'm going to wear a mask, wash my hands. I'm going to go about my business, but I'm going to be extremely careful with the mask, washing my hands, keeping my distance, avoiding large events. As a general rule of thumb, if you want to protect yourself, shared air. Don't share air near anyone. Bars, churches, planes, trains, subway. Don't ever be sharing air. That's a general rule. But live your life. Go out and do what you need to do. Most people have taken on that. So now, where are we? So long term, I'm looking at this. The treatments have gotten much better. So from that standpoint, that's really positive. I think the treatments, our doctors are impressive. It's very impressive. The drug companies, the pharmaceutical industry, the doctors, the hospitals, impressive. The treatments are working, right? You got this Regeneron stuff, the monoclonal antibodies, the dexamethasone, the keeping people on their belly, the hospital, the doctors, they're good. So the death rate, because we're changing behavior, protecting our elderly, testing early, the treatments are amazing, is going down. That's positive. Now, where are we going with this? The vaccine's going to come, that'll change everything? Not so fast. The vaccine, like a cold vaccine, it'll work for the coronavirus you made that vaccine for, but the virus mutates. It's already mutated. I've been reading up to 100 times since March 1st. And now they think it has a mutation D614G. It has more spikes, so it's more infectious. So the vaccines aren't going to be any panacea. Are you going to bet your life that you have the right vaccine for the right virus that you're going to get infected with? No, you're not. So the vaccines aren't going to change anything. So we're looking at, I think, a year and a half, 3 years down the road, we're still going to be living with this. I mean, I don't see things returning back to normal. So we're going to have to come up with some way to mitigate and live with this problem of this COVID and make our lives rich again and figure out how to deal with it, knowing that the treatments are better and the vaccine will not be 100%. Thank you.